Hello, my name is Dr. Amy Feldman, and I am an Associate Professor of Pediatrics at the University of Colorado. I serve as the Medical Director of the Liver Transplant Program at Children's Hospital Colorado and am an investigator at ACCORDS, the Adult and Child Center for Outcomes Research and Delivery Science. Today, I am here to talk to you about the importance of vaccines for transplant candidates and recipients, and to introduce you to a novel mobile health application or phone app that my research team has designed to help increase vaccine rates in the transplant population. A little bit of background. Survival after pediatric solid organ transplant is excellent. For pediatric heart, liver, and kidney transplant recipients, 1 year graft survival is greater than 80%. However, children who undergo transplant are at lifetime risk for infections due to the immune-suppressing medications that they take to protect their graft. Infections are one of the top 5 causes of death in pediatric transplant recipients. Previous work by our team has shown that 1 in 6 children who undergo transplant will be hospitalized in the first 5 years after transplant with a potentially vaccine-preventable infection. These infections can result in significant morbidity, mortality, and increase the cost of transplant hospitalization by $120,000. Many of these infections are potentially preventable by vaccines. However, in a 1-year prospective study conducted by our team, we demonstrated that at the time of transplant, less than 30% of pediatric liver transplant recipients across the United States were up to date on standard age-appropriate childhood vaccines, and less than 20% were up to date on accelerated vaccines recommended for transplant candidates. Half of the under-immunized children were missing 4 or more vaccines. Additionally, compared to healthy children, transplant recipients had lower immunization rates for every single standard vaccine. In order to understand why these at-risk children were not receiving standard preventative vaccines, our team interviewed transplant stakeholders nationally, including parents of recent transplant recipients, primary care pediatricians, infectious disease doctors, nurses, pharmacists, and transplant specialists. We learned that there are 5 common barriers to pre-transplant immunization, regardless of organ type or transplant center. First, there are gaps in knowledge about vaccine use in the pre-transplant period. Second, there is a lack of communication amongst team members about vaccines. Third, it is hard for all team members to access the child's vaccine records. Fourth, it is difficult for parents and team members to keep track of when future vaccines are due. And finally, in the pre-transplant period, children are mainly seen by their transplant team, not their pediatrician, and the transplant team may not be able to administer all needed vaccines. To address and overcome these barriers, we developed a novel phone app called Immunize Pediatric Transplant. This phone app provides several helpful tools for parents and providers. First, it provides information about vaccines and vaccine-preventable infections in the transplant population. Second, it houses a child's vaccine records in one easily accessible place for all team members. Third, it has a communication or chat feature that allows parents, pediatricians, and transplant teams to easily communicate with one another about vaccines. And most importantly, it sends out reminders to parents and physicians whenever a child is overdue for a vaccine. In a feasibility study, 100% of participants said they would recommend this app to families awaiting transplant and their care teams. Thank you so much for taking the time to watch this video. If you have any further questions about the Immunize Pediatric Transplant app or our transplant program, please feel free to reach out via the website or phone number listed. Thank you.